Hello friends, welcome to my channel Clinical Biochemistry by Dr. P.K. Prabhakar. Today I am going to talk about one of the common allergic reactions in these days, especially in the spring season, that is called hay fever, or it is also called as allergic rhinitis. So here we will talk about the causes, signs and symptoms and their pathophysiology. So first let us see what is hay fever. If you will see this hay fever, this is allergic, it is also called as allergic rhinitis. It is mainly causes cold like sign and symptoms, which looks like cold and sign and symptom, but actually it is not the cold. It is characterized by runny nose, itchy eyes, congestion, sneezing and sinus pressures. Its name tells you that it is hay fever, but in this case it is not one, neither it is going to caused by haze or nor it will have fever. Then from where this name comes, this whenever it's a smell like it will call it like hay, that's why it is called as hay fever. Okay, now but unlike a cold, here fever we don't have, and which is not caused by virus also. A name, actually I have told you from where this hay fever name came. It is typically referred to, it does not necessarily involve haze or fever, because it is misnomer you can call it. It does not necessarily involve any of the viruses also. It is widely believed that the condition got into the name because its symptoms would stride during the hay harvesting period, which coincidentally corresponding to the increase in pollen grains due to the pollens also. Hay fever is going to be caused by an allergic response to outdoor or indoor allergens. Allergen can be anything which is going to activate your immune system. It can be pollen grains, it can be dust particles, it will be tiny flakes of skin, saliva, sheds of the cat, dogs or any other animals, or their furs, feathers, anything can be work as an allergen. So hay fever is going to be caused by, it is an allergic response of our immune system because of any of the indoor or outdoor allergens. In this case, the main reason is it is going to cause inflammation in the nasal mucosa due to these allergens, and that ultimately gives us different kind of signs and symptoms. The basic mechanism, if we will say, in this case, it is going to be, this is the allergen we are having. So whenever we are going to have an allergen, they are going to going to activate our immune system, and through different activation going to activate the B cells, and ultimately B cells is going to produce a allergen specific immunoglobulin E. So increased immunoglobulin E production will be there, which is going to bind to the mast cells of the surface. Whenever reoccurrence of the similar type of allergen will be there, this allergen going to bind to this antibody associated with the mast cells, and ultimately it is going to produce two different kind of components. It is going to produce a pre-synthesized components, that is histamines, which is going to works at three different phases, three different type of activity responses it is going to give. It is going to activate your mucous gland, so that mucous production will be there, and that is going to ultimately going to cause your running nose. Then it is going to cause the trigeminal nerves there, and lastly it is going to cause local inflammation in the nasal passage. Second, it is going to secrete releases some of the interleukins like interleukin 4 or interleukin 13, which is going to cell infiltrations into the nasal mucosa. It recruits many different immunological cells, and ultimately there will be congestion and edema will be there. So this is the basic mechanism how this hay fever is going to happen. So this is the summary of this cause of hay fever. Now if you will come to the sign and symptom, what is the sign and symptoms? Hay fever, because it is technically known as the allergic rhinitis, it affects between 40 to 60 million Americans according to the American College of Allergy, Asthma and Immunology. Okay. Various signs and symptoms of the hay fever are easily mistaken from the condition, including the common cold. Now if you will see the sign and symptom, the first symptom is sneezing and coughing. One by one we will talk about why this sign and symptom, each sign and symptom comes. Second is runny nose or blocked noses will be there. Itchy red and watery eyes will be there. Itchy throat, mouth, nose and ears. A loss of smell can be there. Pain around the temples and the forehead regions will be there. Headache, body pain, tiredness and earache will be there, because somehow our nasal passage and the eardrum is going to be connected through and so ultimately it is going to have the ear ache also. Now if we'll see one by one. So first most important symptom is rhinorrhea. What is rhinorrhea? It is going to cause runny nose, and one of the important parameter of this one is whenever we are going to have runny nose, the passage, the mucus whatever secreted through the nose, that is the clear discharge. It will not have any kind of infiltration of any kind of cells or blood or anything. So clear discharge will be there. Mucous glands are stimulated by these histamines, which is produced from these mast cells or other inflammatory cytokines like IL-4 and IL-13, and because of these histamines and other inflammatory cytokines, mucus production will be there, and that is going to cause rhinorrhea. Second important parameter, important sign and symptom is sneezing. Here it is, the sneezing is because of the allergen induced sneezing will be there, and due to histamine induced activation of the trigeminal nerves we can have sneezing. The third important sign and symptom is nasal congestions, because congestion of the nasal cavity will be there and it may cause difficulty in the breathing region also, and because when nasal congestion will be there, we may lose smell and other tests also. It is mainly this nasal congestion is mainly mucus production is mainly caused because of the IL-4 and IL-13, which releases from the mast cell, which recruits the many different cells of the immune system. Ultimately swelling and edema will be there, and mucus releases will be there. Fourth important symptom is called as post nasal drip. In this case, mucus is going to be dripping from the back of the throat. So from our mouth, back of the throat, every time we will, because of the high amount of mucus production, it looks like the mucus is going to be dripping. So it feels like something is back into the throat, and cobblestone throat or pharyngeal pharynx will be caused. So you can see in the back there we are going to have mainly post nasal dripping will be there in the back side. Then fifth symptoms will be coughing, which is non-productive coughing will be there. Means no cough, no any kind of cough will come into the mouth due to irritation from the post nasal drips. We are going to have coughing, but nothing will come out. Then allergic conjunctivitis can also be there, where we are going to have inflammation in the conjunctiva of the eyes, and because of that one, red eye also will be there. Conjunctiva becomes the irritated from the because of the due to allergen. Here also the main reason is histamines and other inflammatory cytokines like IL-3, IL-13, which is going to cause vasodilations, and because of vasodilations there will be inflammations, and ultimately it is going to leads to watering or tear can come from the eyes. Another symptom is nasal pruritus, where itchy nose will be there, and it is going to cause due to the histamine and other inflammatory cytokines. Then we are also going to have pruritive eyes, where itchy eyes will be there. It may be because of the swollen eyelid will be there due to irritation from the allergens, and here it is also going to cause because of histamines and other inflammatory cytokines. Then we are going to have allergic salutes. What is allergic salutes? Whenever we are going to have runny nose, so we are normally wiping our nose upwards or rubbing the nose, wiping or rubbing of nose due to the runny nose to manage that one. And because of this one, we are going to have a transverse line or crease on the nose, and this line may ultimately later on cause hyperpigmentation or hypopigmentation. If you see here, this is the allergic salutes, where these lines will be there, and because this is going to ultimately going to cause hyper and hypopigmentations. Then we can have allergic sinus. What is allergic sinus? Dark circles is going to cause underneath the eyes, and that is because of the congestion of the small blood vessels underneath the eyes, which normally going to darken the appearances. Now you can see in this case, here we are going to have allergic sinus. This is because of the congestion of the blood vessels. Overall, there are, if you see the hay fever, there are two different types of hay fever we can have. What are the two types of hay fever we can have? The first type is called as seasonal. In case of seasonal people, here people may have seasonal hay fever, often experiences worsening symptoms in spring, summer or early falls. Means it is not throughout the years, it will be sometime of the years it will be there, and then later on it will go off. So symptoms are usually the results of exposure to the mold spores or pollens in the air from the grass, weeds or tree. So this is seasonal. Second one is called as perennial, where we are going to have sufferers of the perennial hay fever are symptomatic throughout the year. These allergic reactions are generally to the things that are more persistent, like pet danders, molds, dust mites and cockroaches, which is going to happen throughout the year. if you are going to see the sign comments, the actual pathophysiology of the hay fever, so during the sensitization phase, so we are going to start from this side. So during the sensitization phase, allergens are taken up by the dendritic cells. Like you can see, this is the allergen cells. Whenever it will be coming to the nasal, this is the nasal epithelial cells. Once it will be taken inside, these are the dendritic cells. So these allergens are going to be taken by the dendritic cells, which induce the series of events leading to the generation of the plasma that are produced, plasma cells, which is overall ultimately going to produce the allergen specific immunoglobulin E. As you can see here, this is going to produce the allergen specific immunoglobulin E. This allergen specific immunoglobulin E ultimately going to bind to the mast cells. So here it is mast cells. So this immunoglobulin ultimately binds with the mast cells and the basophil. This is basophil, this is mast cells. Now and ultimately this is going to have, due to the cross linking, they are going to have different types of activity. Okay, in the individual who are sensitized to the allergen, subsequent allergic reaction means whenever further next time an allergen comes to their body, these allergens comes and bind to these immunoglobulin which is associated with the mast cells and the basophilic cells. So in the subsequent allergic exposure activates the basophils and the mast cells in the nasal mucosa, triggering the release of the allergic mediators like histamines and sulfidopeptides, leukotrienes, IL-4, IL-13, and leading to the actual symptoms of allergic rhinitis or hay fever, which is caused. So it is going to have, these are going to activate or going to sensitize these other cells, sensory cells, trigeminal nerves, vascular endothelials, glandular cells, epithelial cells, immune system cells, and ultimately we are going to have these signs and symptoms like itchy nose, sneezing, runny nose, nasal congestions, then rhinitis means other signs and symptoms will be there. Okay, similarly subsequent cytokine production by the memory allergen specific T cells reduces the inflammatory infiltrations, eosinophils recruitment within the few hours, and that is ultimately, this is the process. So this is the how it is going to happen. So this is how it is going to start from this side, and how this is going to cause different kind of sign and symptoms for this hay fever. Now how we can manage this hay fever? So the one of the management, because sometimes it will be non-avoidable, you cannot actually avoid it. Many things, even if you are going to be inside your room, inside your home, you cannot avoid it. So normal, the best way is treating the hay fever is work best under the direct care and supervision of the ENT physicians, and prevention is the best cure. So preventive exposure to the source of your allergen like grass, pollens, pet dancers is a good start, but you cannot avoid it 100%. So whenever you are going to have this type of things, there are some medications which can be prescribed by the doctor, or over the counter medications also can be used, like decongestant can be taken, antihistamines can be taken, or nasal spray can be used, and these may give you some kind of relief. So this was about the hay fever. Because I have told you it is sometimes will be treated as a cold, many signs and symptoms is similar to the cough and cold. So there are basic some differences are there, how you can differentiate that it is you are having hay fever or you are having cough and cold. So the first is timing. Hay fever normally begins immediately after the exposure of the allergen, because it is an allergic reaction, and common cold is a viral reaction, so cold begins 1 to 3 days after the exposure to the virus. Then second major difference is between the durations. Hay fever lasts for as long as you are exposed to the allergen, typically several weeks, and cold usually lasts 3 to 7 days. Once viral will subsides, cold will go off. Symptoms: hay fever produces a running nose with a thin watery discharge, clear discharge. In case of cold, causes a runny nose with a thicker discharge that may be yellow in the color also. In the case of hay fever, it will be clear discharge will be there. And fever, in case of hay fever, fever never comes. It is just a misnomer that name is hay fever, but you will not get fever at all. In case of cough and cold, typically you will get a low grade of fever. So this is the basic differences between the hay fever and the cold. Hope you have understand it. If you have any query, any comments regarding hay fever or any other topics, you can write in the comment box. If you like the video, press the like button. If you're not subscribed my channel, you can subscribe it. You can follow to me on different social networking sites. Thank you very much. Have a nice day.